Napa 4. Produced by Beximco Pharmaceuticals Limited, Bangladesh. Product overview. Trade name, Napa 4. Generic name, Paracetamol, 10 mg per milliliter, for infusion. Production company, Beximco Pharmaceuticals Limited, BPL, Bangladesh. Category, analgesics, antipyretic. Price 100 ml bottle, 120 takas. Commercial pack, Napa 4, supplied in a 100 ml glass bottle containing 1000 mg paracetamol, 10 mg per milliliter. What is Napa 4? Napa 4 is the intravenous infusion formulation of paracetamol. Paracetamol is an analgesic and antipyretic agent, recommended worldwide as a first-line agent for the treatment of pain and fever in adults and children. Napa 4 is a sterile, clear, colorless, no-pyrogenic isotonic formulation intended for intravenous infusion. Why Napa 4? The easiest and cheapest method of administration is oral, but that is not an option intraoperatively or in some patients with bowel obstruction, for example. The rectal form of administration is unreliable and erratic. It gives a very variable peak plasma concentration, which is also reached later, at 2 to 3 hours. As with most drugs, intravenous administration is more reliable and reaches peak concentrations faster compared with oral routes, as proven for paracetamol. Paracetamol has a different mechanism of action compared with usual analgesics like opiates and non-steroidal anti-inflammatory drugs, which have considerable adverse effects. Since paracetamol's side effect profile is considerably superior, availability of an intravenous form is very useful when other routes are less feasible. When to take Napa 4? Napa 4 is indicated for the management of mild to moderate pain, the management of moderate to severe pain with adjunctive opioid analgesics, and the reduction of fever. Dosage and administration. Adults and adolescents weighing 50 kg and over, the recommended dosage of paracetamol 4 is 1000 mg every 6 hours or 650 mg every 4 hours, with a maximum single dose of paracetamol 4 of 1000 mg, a minimum dosing interval of 4 hours, and a maximum daily dose of paracetamol of 4000 mg per day. Adults and adolescents weighing under 50 kg, the recommended dosage of paracetamol 4 is 15 mg per kilogram every 6 hours or 12.5 mg per kilogram every 4 hours, with a maximum single dose of paracetamol 4 of 15 mg per kilogram, a minimum dosing interval of 4 hours, and a maximum daily dose of paracetamol of 75 mg per kilogram per day. Children 2 to 12 years of age, the recommended dosage of paracetamol 4 is 15 mg per kilogram every 6 hours or 12.5 mg per kilogram every 4 hours, with a maximum single dose of paracetamol 4 of 15 mg per kilogram, a minimum dosing interval of 4 hours, and a maximum daily dose of paracetamol of 75 mg per kilogram per day. Pregnancy and lactation. Pregnancy category C. There are no studies of intravenous paracetamol in pregnant women. However, epidemiological data on oral paracetamol use in pregnant women show no increased risk of major congenital malformations. A paracetamol 4 should be given to a pregnant woman only if clearly needed. There are no adequate and well-controlled studies with paracetamol for during labor and delivery, therefore, it should be used in such settings only after a careful benefit-risk assessment. While studies with paracetamol 4 have not been conducted, paracetamol is secreted in human milk in small quantities after oral administration. Pediatric use. The safety and effectiveness of paracetamol 4 for the treatment of acute pain and fever in pediatric patients ages 2 years and older is supported by evidence from adequate and well-controlled studies of paracetamol 4 in adults. Geriatric use. No overall differences in safety or effectiveness were observed between these subjects and younger subjects. Another reported clinical experience has not identified differences in responses between the elderly and younger patients. Patients with hepatic impairment. Paracetamol is contraindicated in patients with severe hepatic impairment or severe active liver disease and should be used with caution in patients with hepatic impairment or active liver disease. A reduced total daily dose of paracetamol may be warranted. Patients with renal impairment. In cases of severe renal impairment, creatinine clearance 30 ml per minute, longer dosing intervals and a reduced total daily dose of paracetamol may be warranted. Contraindications. Paracetamol is contraindicated in patients with known hypersensitivity to paracetamol or to any of the excipients in the intravenous formulation. In patients with severe hepatic impairment or severe active liver disease. Pharmaceutical precautions. Store in a cool and dry place and away from children. For single use only. The product should be used within 6 hours after opening. Do not refrigerate or freeze.